So I'd like to welcome our guests this morning to our first edition of the Quality Show. If I can ask you all to introduce yourselves, please.
Hi Pauline, I'm Christine Hawley. I'm a mental health nurse and I work at the community team at Tunstall at the Greenfields, and I've recently passed the Quality Improvement Leaders course.
That's excellent to hear. Well done and congratulations on that.
I'm Rachel Woolscraft. I work as a quality improvement facilitator within the QI team within Combined and co-deliver the programme that Christine's just been taking part in.
Welcome.
My name is Alicia Truman. I work across two teams, patient safety team and the quality improvement team. And my role is very much focused around learning from patient safety incidents. And obviously what's better way than to ensure that learning is sustainable than to use QI methodology to address it.
Thank you very much for that. So welcome all of you. I just want to set the scene really for our discussion this morning, and we are going to use a little bit of some statistics behind us that will have come from NHS England. So according to the Carers Trust, many carers do not identify themselves as a carer in terms of their relationships with either their parent, a child, a friend or a neighbour that they care for. However, even given this caveat, according to NHS England, over a 10-year period, so that's from 2001 to 2011, the number of unpaid carers grew to over 600,000. And they estimate that this equates to 1.4 million people who are actually providing 50 hours or more of unpaid care per week. Now, for me, that's actually quite a staggering figure, and I until I looked at this, I was unaware of it. So I just wonder if I can ask the three of you to maybe give some comments and reflection on that.
I think if we know that 1.4 million people are unpaid carers, there's also a lot more paid carers. And I think their role is so vital to the NHS and to health and social care services, because if they weren't there, our services would be a lot more overstretched than they are today.
So you're saying that some carers can be paid, but some carers aren't paid. Do you want to just maybe explain that to us?
I think because a lot of people don't recognise themselves as carers, it's my daughter, I look after her. I think there's a lot of people who don't recognise their role.
So do you think that the 1.4 million that it says here, do you think it's actually more than that?
Absolutely. I think even with your project and your engagement, you found that carers found it really difficult to identify as carer. So I think that figure is quite underrepresented really. If we, if people recognise their caring role, that would be considerably higher.
Okay, that's lovely, thank you. So we're going to be discussing the details of a quality improvement project, and that has been undertaken to support carers. But before we go to the specifics, maybe can I ask you, how did you get involved with quality improvement?
I've always enjoyed completing a project, whether that be big or small, about staff morale to patient service. And my manager had just completed the QI training, and she knew that I would thrive getting the evidence base to my projects.
Okay, lovely. And can I ask, ladies, is there any other way in which people tend to get involved in quality improvement?
Absolutely. There's the programme that Christine's took, which is the Quality Improvement Leaders, which is over 8 months and it's 1 day a month. There's also Quality Improvement Quick Start, which is a much shorter way of getting involved, and that's over 4 weeks for a couple of hours. There's also the Quality Ideas Cafe that you can pop into, very informal. You can just join and have a conversation with the team there, but also you can call us directly as a team.
And how often does that cafe happen? That sounds interesting.
Once a month.
Brilliant. Okay, lovely.
Thank you.
Okay. So let's turn to your quality improvement project then. I suppose first of all, let's think about what your problem was and how did you actually identify the problem that existed that then was kick-started your project?
Well, I've worked in combined for 20 years now.
Yeah.
And over those years, we've always outsourced carer support to North Staff's Carers, Staffordshire Together. And it was a question really of, are the carers actually utilising this support? They are such an important part to our patients' care and recovery, but are they actually taking advice from staff? Are they utilising this support? So it interested me.
Okay.
So that's where the seed was planted.
And did you get a sense that they weren't? How did you know that there might be a problem with that? Were there any things that sort of triggered your mind to think, actually, I'm not sure they are accessing it?
Yeah, well, I think initially, I got into a steering panel for the triangle of care.
Okay.
And listening to the panel discuss things, that sparked my interest. So I got in touch with North Staff's carers and asked them how many referrals were made in a period of 3 months. And the numbers were a bit shocking.
Okay, so that's, you were able then to actually access data that enabled you to realise there was an issue here.
Yeah.
Brilliant, that's lovely. So let's have a look at the goals that you set yourself. So if we take the first goal, which I think we can see that comes up here, is to improve the number of staff, patients and carers trained in the triangle of care approach, working together to provide holistic care. So first of all, could you just tell me what that triangle of care it means?
Triangle of care, it incorporates the whole cycle of support for a patient. It's the patient, it's professionals and it's their carers.
Okay.
And it incorporates all three people in that recovery.
Okay, lovely. Okay. And so what we can see is that you wanted to start from a baseline of 0, which I think is incredible. And what did you want to get to?
Well, I think on the learning management system, there is training for triangle of care approach. And when I initially looked into that, nobody in the team had completed the training. The training isn't mandatory.
Yeah.
So maybe it wasn't being advertised enough so that was something that I really wanted to look into, because I know just that little bit of training may improve staff's awareness of who could be a carer, unpaid, recognised, and give them a bit more confidence in what to do when they're working with carers.
Okay, so the first one was actually the training. We wanted to improve that.
And I think through the leaders programme, the quality leaders programme, we spend a week, don't we, or more, talking about the importance of your baseline figures, looking at what is the current state, because what happens along when we start implementing change, we need to know, has there been an impact? So that was a really useful way for you to evidence where we are right now and where you were after the change.
Okay, and then if we go on to the second goal, and that seems to be all around improving patient carer referrals, so to the North Staff's Carers Association. So you wanted to see an improvement in that. And you start here with a baseline of 3, and actually you've got a goal of 100%, so that's quite a stiff target, quite an ambitious target. I just wonder if you can talk us through then, how did you decide on these goals and how did you set yourself, if you like, the targets that's sort of within it?
Yeah. The target I set of 100% is I didn't want any carers coming through without support.
Okay.
So I was very passionate about that even if we made a referral and they decide it's not for them, they've got an option. So to do that, I became the carers lead nurse in the team to support staff in making them referrals, and that helped me to achieve them goals so much.
Okay, lovely. And you know, in terms of goal setting, in quality improvement generally, would you say that is something about, what would you say the most important things are for people to think about when they're setting themselves a goal?
I think it's about getting an aim. Where are we aiming to be? What's the aim of the project? And that can be quite tricky, can't it, initially? And sometimes that's probably the hardest bit to get going with. But once you've got your aim, you can then start collecting your data. You can then start planning what plans are you going to step, what changes are you going to make. And then we do the doing, but then we do the studying of that.
Do you think sometimes in your roles as sort of supporting quality improvement and learning from experience and things across the trust, you have to maybe help people be a little bit more realistic about things at times? Yeah.
We always say it, and I think this was a bit of learning for you, Chris, wasn't it? That people think it's got to be massive, it's got to be a huge project. It can be small, and you can make the biggest impacts. And the process helps you to plan and trial it, and then keep testing it. It's about learning each time we make a change. And that's what you've done throughout your project, isn't it? Keep going back to the data, keep making those changes.
But going back to your goal, I mean, I think the 100% is a very worthy goal to have had, and, you know, actually appropriate in this case, whereas it might not always be in every case. But okay, so that's great. It's really good to understand that. I believe you've designed 3 interventions. So shall we go through those 3 interventions? And would you like to tell us a little bit about these? So we have the first one, as you can see up here, the increased promotion of training. So how did you go about that?
I went about that, and it was quite simple, really. We have a morning meeting every morning. We have team meetings once a month. And it was just encouraging people to have a look at the training, the Triangle of Care approach training, and to do it. You know, it was we've now got each monthly team meeting a section for carers, so I can feed back how my project was going on and how many people had completed the training, so it had nudge other people to do the training.
So there was that ongoing motivational nudge. And sometimes you can pop a little bit of competition in, can't you?
Absolutely.
Well, this team has done this much, and, you know, you need to catch up. So I can see how that worked. And I can see then the other one was the in-house carers support group. So do you want to tell me a bit about that?
Yeah. Initially, I wanted to know what the carers wanted. So I invited a number of carers to come and be a bit of a steering group to let us know what they would find helpful from secondary services. And because we are based over in Tunstall, they felt as though there wasn't much provided that side of the city. So they wanted a local group that specialised in mental health. So that's where, and then spoke to the team management, and they were really happy for me to you know, utilise the building and bring carers in.
Brilliant.
So
lovely. And then the final one is the carer lead nurse. So I think you mentioned at the beginning.
I did,
that you tell us a little bit about that.
So I think the role as carers lead nurse, it evolved quite naturally, because as I was talking and doing different things like the fishbone cause and effect diagram, process mapping with the team, and I became the spokesperson for carers. So it naturally fell onto me then, which I was very happy about, because it gave staff a person to go to with any queries, if they needed assistance with referrals. And it's been really valuable for the carers and the team.
Brilliant. Okay. So did you experience any challenges within these sort of intervention development and delivery, and where did you get support while you were doing it?
I did have a few barriers. Obviously, I said to you about with training, it's staff time. All the staff are very busy. And when I did need support, the QI team, the facilitators were amazing.
Great, yeah. And so what sort of things were they able to support you with?
I think in the beginning, as Rachel said, you have big ideas. You want to change the world. And when you realise you can't, and that you need to scale back a bit to make things more realistic, they keep you grounded.
Okay,
they are amazing at keeping you focused on what you want to achieve and how to achieve it.
Was there anything you'd like to add to that in terms of the way in which the teams, both aspects support people doing projects like this?
Well, it might be worth adding that in order to successfully embed quality improvement culture, we are focusing on a new type of leadership that moves away from imposing ideas top down to focusing on our frontline staff, on our patients and on our carers. And therefore the trust invests a lot in creating the QI leaders, people like Christine, our frontline staff.
On what matters to them.
Yes, exactly, and focusing what matters to them. And the same with our QI team strategy. We are focused on empowering our frontline staff and focusing what matters to them, what change they want to make, and then being there for them, providing QI methodology and support.
Brilliant, that's lovely.
And I do think that we're not just, as a team, we're quite flexible. We'll meet outside of those team, their monthly meetings. We often have team catch-ups, or we can have one-to-one. So the support is there from the team if you want a conversation, which we utilised, didn't we, during your project?
We certainly did.
Brilliant, thank you. So we're doing this edition of the Quality Show in December 24 in the build-up towards Christmas festivities. So let's have a little look at your progress so far against the goals that you'd set yourself, and think about what's been the impact of actually your project. So if we look at the statistics here, wow, so we've had 11 staff trained so far, which is great, that's 35%. And we've had carer attendance of 166%. That's amazing. And we have got the referral rate at 100% and completion rate at 100%. Do you want to just tell us a bit more about this? Sort of give us a bit more of an understanding of what this is saying.
Yeah, I think the 11 members of staff that are trained now, and there might even be more than that now, from when these were taken, and that's a quarter of the team. And it's huge with the demands on the team for them to have completed that, but that's also had an impact on the referral rates to carer services. It's also had an impact on carer attendance to the monthly support group, because I've been making them aware as we've been discussing carers. So staff are a lot more confident in offering these things to carers.
So what you could see is that the referral rate has increased dramatically and gone up to 100%. And part of that is because people now understand, because they've been doing the training. And maybe even if they haven't done the training, just your presence and your lead nurse role is actually giving that information to people.
And The training will help staff understand how they fit into it, with like Christine was saying, carers, service users and the professional, so they'll be a little bit more confident and aware about how to support carers. So that will definitely help improve awareness, but also referral rates, and giving carers the option and the choice if they would like that extra support.
Brilliant. Well, I'd just like to say congratulations. It's obviously been a really impactful project that's making a difference to carers and the people that they're caring for. So that's really important. So that brings us to the end of the first edition of the Quality Show, and I'd really like to thank you all for participating and sharing your experience with us today. It's been really interesting discussion, and I've certainly learnt a lot from it today. So generally, if you have any feedback or suggestions for future editions of the Quality Show, our Associate Director of Communications, Jo McCree, will be delighted to receive them. And thank you very much, everyone, for your time.
Thank you.